Okay, so we are doing a full tiered assessment of the elbow. So tier 1 for inspection, I'm just going to observe, look at the carrying angle on both sides, comparing them side to side, looking for any obvious signs of trauma, bruising, swelling, anything like that, looking at the bursas behind the olecranons for any inflammation. Then I'm also looking for musculature, looking at if there's any obvious signs of shortened or lengthened musculature. All looks pretty good, maybe a little bit of tightness right in there. So then I'll have you lay down on your back, and we'll move on to tier 2, which will just be palpation, ranges of motion, active and passive, and then the assessment like we learned in class. So to start with, I'm just going to palpate all the bony landmarks, the ligaments. I would compare it to from side to side, but just for sake of time, I'm just gonna do just the one side. Feeling for any tightness, any tenderness that would indicate like signs of trauma or injury. Feeling the musculature for different changes in tone. And then, yeah, palpating all the bony prominences, making sure there's no impingement sites for any of the nerves or any of the attachment sites for musculature. Okay. So then I'm gonna just have her go through active range of motion. So if I could have you bend your elbow as far as you can, bringing your hand to your shoulder. Good. And then I'll have you just lay your arm as flat out on the table as you can. Good, and she can fully extend it on the table. Then if you wanna bring it up like this, I'll have you rotate your hand up toward that wall as far as you can.
Like this?
Yep. Looking at supination, then I'll have you turn your hand down towards your feet as far as you can. Good, pronation. Then I'm gonna just take her through those motions passively. So you just let me do it, let me know if there's any pain. And up in flexion, all the way down in extension, supination, pronation. Good. Then this is where I'll do the assessment. So I'm just gonna slide the camera over. So I'm going to start with radiocapitular joint. So first, I'm just going to stabilize the humerus. I'm gonna find the radius. Oh, there we go. Find the radius. Pressing P to A, and A to P, feeling for the springiness. Then for both the ulna and radius, we can do them at the same time. I'm going to do translation side to side. So stabilize one side, pushing M to L, L to M, feeling the shearing forces between there. Then I'm going to do the A to P motion up in flexion so that it moves to S to I. S to I on there, and then I to S, feeling the springiness. And then we can also do translation across this way too, and it also counts for the ulna. So I'm going to stabilize the humerus, pushing M to L, L to M. Then for the last one for the radius is I'm going to be doing long axis distraction. So I'm just going to place my thumb up in that joint and then hook the bottom of the radius here and just gently distract downward, feeling that joint gap open just a little bit. Then we'll move on to the ulna. I'll stabilize the humerus from underneath. And then I'm going to just be pushing A to P. Okay, already did translation. Then I'll move up into flexion. Same thing, going S to I. Okay, and then the last one for that is valgus varus movement. I'm just gonna gently hold down here at your wrist, pushing into valgus, varus. So then in addition to all that, this is also where I would add in any orthopedic tests, depending on what her chief complaint was. If it's a nerve complaint, it would be like nerve tension test or something like that. If it was a bony prominence pain, lateral medial epicondylitis, thinking of that, we could do any of those tests. And then we would move on to tier 3, assessment, which is mostly muscle testing. So I'll actually have you sit up and face this way. I'll tilt this up a little bit. So then, same thing, I would do all of this bilaterally, but just for the sake of time, I'm going to just do one side. So I would start with flexion with the bicep muscle. So I'll have you bring your arm up like this. Don't let me pull toward me. I guess I can do it on both sides, it's not too hard. Assessing both the biceps. Then I'll have you flip your wrist forward to assess the triceps. Don't let it push towards you. Good. Good. Then I'll have you bring your elbows down to 90 degrees flexion. Tilt your wrist down. Perfect. Now don't let me push down toward the ground. Good. Good. That's for brachialis, or brachioradialis, I apologize. And then I would do pronation and supination. So I'll have you bring your wrists up this way. Don't let me pull them down. Good. Good. And now opposite, flip them down. Don't let me pull them back up. Good. Good. Then I'll have you bring your wrists down. I'll have you extend them up. So then evaluating extensor carpi radialis and extensor carpi ulnaris, as those both have insertion sites up in the elbow. And then I'll have you lay your hands flat and then extend your fingers up. So then for extensor digitorum, good. So that would be the full assessment for the elbow. If you're having other concerns, you could also do muscle testing for flexors of the wrist or shoulder musculature if there was anything concerning you there.